I gotta wait. Good afternoon. This is the House Appropriations Committee. It is Tuesday, April 22nd, 2025. It's 1 o'clock, and we are continuing our conversation with people about federal funding and potential changes or real changes in some cases. And this afternoon, we have Big Hartman with us from the Human Rights Commission to talk about what's happening in their world. So thank you very much for joining us. We appreciate it.
Hi, thank you for having me. I'm Big Hartman. I'm Executive Director and General Counsel at the State of Vermont Human Rights Commission. I did actually go ahead and prepare written testimony for you all today, which is not usually my style, but I did it. I have hard copies if folks wanted that.
Thank you.
Thanks so much for having me in again. You all look a little lighter than last time I was here, and I think that hopefully that means you're feeling better.
And you're the we got here.
All right, that explains it. Yeah. I feel no lighter than last time I was here. As you all know, the mission of the Human Rights Commission is to advance full civil and human rights in Vermont. So we are the only state agency responsible for enforcement of our state level anti-discrimination protections in housing and places of public accommodation. As you may recall, we also enforce state anti-discrimination protections as they apply to the state of Vermont as the employer. Our federal funds really relate to fair housing. So I wanted to add that at least half, it's more than half actually. I just ran a query before I came over here that it's more than half of our current caseload involve fair housing complaints. What we've seen in the last 4 months is that Vermonters experiencing discrimination can no longer rely on federal civil rights protections. The federal agencies that we often collaborate and coordinate with, including HUD, the EEOC, the Department of Justice Office of Civil Rights, and the Department of Education Office for Civil Rights, are all deprioritizing enforcement of anti-discrimination protections, especially for people of color, trans and queer people, people who are not born in the United States, and people with other marginalized identities. These agencies are being gutted of staff and resources. Their websites are being significantly altered to provide less information for people about their rights and their responsibilities under the laws. And the historical enforcement priorities of these agencies have been drastically upended. Also, the federal government has declined grant funding that had been promised to many Vermont nonprofits who provide advocacy services and supports to people who have experienced discrimination. All of that means that there's an increase in the demands upon HRC's very small team to provide even more services for the public, including intake, complaint drafting and processing, requests for training and education, and enforcement through our litigation. So to support our enforcement of our fair housing laws, the HRC has had a cooperating agreement with HUD since 2001. And we're participants of what's called the FAP program, the Fair Housing Assistance Program. So as part of the FAP program, we go through a performance review. We go through a renewal process every 2 years. And pursuant to our FAP agreement, because we have state law that's considered substantially equivalent to federal fair housing protections, the HRC conducts investigations of any and all fair housing complaints that implicate both federal and state law. So we're required to report frequently to HUD about our fair housing investigations, and we're required to conduct investigations into any fair housing complaint that HUD refers to us.
I have a quick question for you.
Sure.
You said performance review and renewal process every 2 years. Where are you in the current?
We just finished our, what they call a PAR. We just finished it like a couple months ago. I really didn't know what was going to happen after I went through extensive effort to satisfy all of their requests and provide all the data and lists and everything. Then I heard nothing for a while, and all of a sudden I got word that we were approved. We've made it through our PAR.
Okay,
So
well, that's good for 2
Yes.
years, right?
Yes.
Oh, great. Okay.
So our performance year with HUD aligns with our fiscal year here. And under our agreement, HUD pays HRC based on our performance. So it's not a set amount each year. It depends on how we did the year before. So essentially, the more complaints we close, the more money will be paid under our contract at the end of the performance year. There's base administrative funds that provide a set amount of money, and that's to support our general operations and make sure that our staff get training on fair housing. But historically, our administrative funds, there's like tiers depending on how many cases you process each year. And we've been at the lowest tier because we've been closing under 30 housing cases per year. In addition to those base administrative funds, we're also entitled to payment for each case we close. And they have different values of how much they pay us, depending on how the case closes. But any case that has a settlement or a determination is going to receive somewhere between $1,600 and $3,400 per case. And it's really about the type of closure. So a case that goes all the way through an investigation and has a determination, regardless of whether it's grounds or no grounds, it's going to be paid the same amount. And that's going to be that $3,200 actually.
I just want to try to understand the scope. So when you were in here before, maybe it was part of your budget request. I think you had estimated that about 9% of your funding overall was federal. Is that what you're getting here still fit within that?
So I'll get into that, but yeah,
Changes that we might do in the budget, but
the budget is right around 9-10% for fiscal year 26.
okay, and how much of that 100,000, give or take, is what you're just talking about, the billing after the fact for a case?
Most. The administrative funds have varied each year, but they're about 1,600 or 16,000 to like 25,000. It's not a large portion of that total that we get each year.
Okay, so what happens if you don't have many cases? The 100,000 is just kind of a placeholder?
It's an estimate. I believe finance and management estimates it based on the average of what we actually received in years, like maybe going 3 or 4 years back. Okay.
What if you have more cases?
So if we have more cases, we get paid more. And it's not about having, it's about closing those cases. So this year, this current year that we're in, I saw that our HUD contract was the only place we could actually increase our funds, right? So I prioritized receiving and closing more housing cases this year at our office. And we have closed and accepted more cases than ever before in housing and in general in the last year and a half that I've been director. So we stand right now if, and I want to just stress that it's a really big if HUD actually pays us for the work we performed this year, we would stand to get quite a bit more than what's currently in our budget. But there's a big but there, but we really have very little confidence that HUD is going to pay any of the FAPs anything for the work that we've done this year. I'll keep going and we'll talk about it a little bit more, okay?
More of it may become clear as finished. Yeah, go ahead.
So the way it usually goes is that when we get to the end of at the end of the performance year, which is also the end of the fiscal year, we tally up with HUD all the cases that we closed and how much each one gets. Now that we have more litigation that we can do ourselves, there is more HUD money to earn from filing a lawsuit. You get $8,000 per lawsuit that you file, whether you settle it the next day or you litigate it for the next 10 years, it's that flat rate of $8,000 per lawsuit. And so what we budgeted for fiscal year 26 is just almost 93,000, 92,773 for our HUD agreement. That, I just want to put in context, represents less than one investigator's salary, benefits, and the associated expenses. And like I said, based on how we performed this year, we are estimating that we would be entitled to much more than that. It could be, I'm saying in this, over 100,000. There's some question about which cases they're no longer going to pay out on, and that's especially the cases involving gender identity as the legally protected class. But so I can't totally predict both how many more cases will close before the end of the year and how much will get paid on all of those. But I expect if we get what we are entitled to, it's going to be like maybe up to 120, maybe even 150. If we really are able to continue to close several housing cases per month. But many in the FAP world across the country are very uncertain about those funds coming at all. HUD has been targeted for substantial cuts by the current administration. It's estimated that up to 75% of HUD's fair housing staff are going to be laid off in the next few months. We're already seeing layoffs have an effect on our operations, including the individuals that we would typically report to every day about our case closures. That person has been laid off. The local fair housing office in Burlington, I just learned that there was a layoff there, probably more. I'm just hearing individuals. And then, like I said, in February of this year, we learned that HUD would no longer pay out any cases involving gender identity discrimination. That represents a very drastic change in policy. It doesn't impact a huge number of our cases, but we are also predicting that HUD will change course on claims involving sexual orientation discrimination as well, which would also impact our funding. Of course, the trans and queer community needs us to continue to investigate those claims, and we'll continue to do so regardless of whether we're going to get HUD dollars for that work. But we definitely feel that the likelihood of FAP contracts not getting honored by the current federal administration is growing every day. I've spoken with FAP directors in other states who are all making plans for their state budget process to make up for the anticipated lack of federal funds from the FAP program and HUD. For example, in Massachusetts, my counterpart there has requested $1 million in state funds to replace their anticipated HUD funds under their FAP agreement not being paid out. So while we're stressed by the uncertainty of the funds, we're also experiencing an increase in demands for our services as the Vermont Legal Aid and CVOEO can't provide the level of support for folks who have cases with us that they once could. Legal Aid would represent somebody who's a complainant in our case. They would draft the complaint for us. They would do an intake for us. Now that's work that's being done literally by me.
So they can't do it? They're over themselves?
HUD has pulled their grant.
Their grant. Okay.
They can no longer carry out their housing discrimination law project. And that has been the case for a few months now. And we are definitely feeling the effects of that as folks now have to come directly to us and wait for maybe 6 to 8 weeks to have an intake meeting and then wait another, I don't know how long, for me to draft a complaint. Most of the complaints I'm currently accepting right now are on hold. I don't have an investigator to do that work. I don't have the staff to carry forward investigations that are currently coming in the door.
So big, good, you go ahead.
I only heard something about legal aid in terms of reductions. Have they had staff cutbacks as a result of the federal grants? I have no idea what part of their organization that represents.
So they do all these other projects, and I think what has happened is the staff that were working on the housing discrimination law project are being reassigned to other projects. So often, if they can get coverage under their disability discrimination project, they can kind of move a case from that grant over to this existing grant that is in it
So this
still alive.
area doesn't pay for them in terms of reimbursement, so they've maybe doing less of that.
They've lost what was called a FIP grant from HUD. It just hasn't been picked up. Like their old grant expired, I want to say in January, and it has not been renewed even though they have applied for it. I'm not sure though, and you would want to ask them about if they've had to actually cut staff or whether they've just reduced hours and kind of reallocated the positions to different grants.
So, my question is, and then I'll go to Lynn, and John, if you have a question too. Who else gets HUD funding? And so now, I mean, we knew about, Human Rights Commission, and now I'm not aware of all of them. So legal aid clearly does. Sounds like OEO gets.
Yeah, so
Who else?
there's only one FAP program in the state, and that's us.
Okay.
That's the enforcement and investigation. The FIP programs are CVOEO, who has not received a renewal of their grant,
Yeah.
even though it's a statutorily mandated appropriation. And Vermont Legal Aid is the only other FIP agency that I'm aware of that receives HUD dollars to do advocacy and like actually represent people who have complaints.
And then John.
Yeah, how many complaints are you getting for this 92,773 budget? I mean, we're talking 10 complaints, we're talking.
That number is probably estimating, if we look back over averaging prior years, it's probably around 20. This year, we expect to be over the 31. That was my goalpost for us to get into the next tier of administrative funding. So we would get an increase in base funding, plus we'd get paid more per case. I actually think 20 is a little bit high of the historical number in recent years of how many housing cases have closed.
So those are just housing cases.
Just the housing ones, yep, which is about half of our total caseload on a given day.
So other than the
I do.
gender issues, how many of those do you have, and what other ones are you getting besides that?
Right now, we only have 2 cases alleging gender identity discrimination that are dual filed with HUD that have been flagged in the HUD database system as not eligible for payment. So that might mean that we don't get up to that 31 number because we're just making it with only 3 investigators. And was the question about what other kinds of cases are there?
I mean, obviously, if you get this majority of housing, you've got this very small group of housing that involves the gender identity, what else is in there that?
The bulk is going to be disability discrimination complaints. Often, folks with disabilities need reasonable accommodations that they're entitled to in their housing, changes in how things are done that are necessary for them to be able to use and enjoy their dwelling. So a lot of our cases tend to be disability discrimination. And then there's a portion, quite a bit, that are also racial discrimination and harassment in housing.
And then Lane.
Couple of questions. I'm always curious about communication between various entities in the federal government. So a couple of questions, if you don't mind here. So when you close gates and that gets sent to HUD, they receive it. Do you receive anything, any acknowledgement back that it's been closed on your end, or are you just kind of waiting until a point in time when they're going to, reimburse what's been paid, or do they do it in one lump sum?
Yeah, so there's a few hoops you have to jump through. It's a bit time consuming, but we have to upload. We have to upload the closing documents into the HUD's electronic system. And then we have to send an email to HUD to say this case closed. That will flag it for the person who's supposed to review the file and authorize the payment. So it gets on the list for the end of the year. Those individuals who review it and approve it are the people who are getting cut. Typically, I would meet with those folks once a month and we'd like go through all of our cases and make sure that everything's on, we have all the cases on each other's radar. And if one case or a few cases are really old, they're going to be like, why are you taking so long? That kind of thing. I haven't had one of those meetings in several months. There's my point of contact, what we call the GTM, which is like a regional person, has been laid off. And so now like her boss is the person who has to do that job. And I think he's doing 5 other jobs and I'm not sure how much longer he will be in his position. So I think the big concern is there's going to be so many cuts that there's not going to be anyone to process the payments, let alone is there going to be appropriation to actually pay.
So
a fact.
So at the moment, and you've had a contact you've been working with here for some stretch here. Understand there's a person taking the place of the person who's no longer there, but have you received any communication from that person yet? Or is it just adjusting to?
All I've heard is
Their end with folks that were for them or with them.
All I've heard is, I am your new GTM and no time for anything else. No, like, let's set up our next monthly meeting, nothing. So I'm worried for what he's been asked to do in one human
Sure.
being's role. Yeah.
But typically, prior years, right, you've closed your cases, it's added up to a certain amount, you've received that back.
We receive it in one lump sum.
Some.
And so,
Fiscal year, is that how that?
yeah, so it's kind of like in June and July, we start sending each other lists. Like, here's the list. These are the cases that we closed. Are these all on your list? This is how much each one is entitled to payment for. Here's the total. That means you're entitled to this for your administrative funds and this for your training funds. So those conversations are usually happening in July. And then we are clear on the number pretty quickly. And then the payment usually gets issued in August. So I feel very anxious that we're going to be at the beginning of this fiscal year before we know if it's happening or not. Yeah.
Thank you.
And as you know, our office is so strapped that losing the salary for one position out of 7 that we have is deeply unsettling because we are already so strapped.
Thank you.
Yeah.
Wayne and then Tom, and then we'll wrap up.
So how long has the commission been running? How many years?
Since 1987.
87. So your average caseload's around 20 to 30?
Of house, average caseload of what, of all current cases we have right now?
Well, you mentioned those, you were talking specifically before with numbers about housing, right?
Yep.
So the housing, and how many other cases that are not housing related?
Like, have we closed or how many do we
Have
have?
outstanding at any given time.
Any time, any year, just roughly how many you got
So
under investigation or in some part of the process?
We have 92 cases that are currently open. And that does not count the 86 that are currently in an intake status, waiting for me to make a decision or waiting for additional information or waiting for an intake meeting or waiting for a complaint to get drafted. Out of those 92, 46 of them are housing cases. This is a substantial increase from where we were a year ago and where we were 2 years ago. I have undertaken innovation in our office to increase our capacity substantially. And we see that, like, last year, we closed 50% more cases than we closed the year before.
So what proportion are found that you find that are founded?
I think that the data last year was of cases that went all the way to a determination because many settle. But of the cases that closed last year with a determination, that it was about 2/3 were found to have reasonable grounds that discrimination occurred. Several of those will settle after that determination. And we currently have 16 cases that are in litigation.
And wait, Tom.
And I just want to follow up with that and just really emphasize that this exercise is about the federal impacts. And the increase in cases, the decision to take on the increase in cases, because they exist. So it's not like these are being invented simply because you're focusing more on them. And it's also taking away with your limited staff. So there's that. There's the testimony that we received. Possible impacts of federal funding are not minimal, but they exist. The state doesn't pay for any of this through the Department of Housing and Community Development, though they could. They did recognize Fair Housing Month very cleanly, so they understand how important it is. But the lack of, and we've had this conversation throughout the session about the lack of capacity for the Human Rights Commission. The choices that we're making not to fund it, to have enough staff to even take on the cases, will delay justice in the cases that are out there. And there's going to be delays in making determinations whether or not the Human Rights Commission will be able to have the time if the executive director is to intake rather than actually managing the office. There's a lack of capacity. So that's a budgeting process for us. I just wanted to make sure we're clear that that part of it impacts the housing portion of it as well, no matter what happens in DC and how we don't get paid back. So I just wanted to make sure we're clear on that as well. So the federal funding part is clear that HUD is not able or is not willing to pay for certain cases. And that's where you are. If I drew that picture.
Yeah, and I guess I'll just also add to that we also are turning cases away every day that could generate more money from HUD, but we just recognize we don't have the capacity to process them. So I am still in a position of saying no to complainants who have no place else to go for justice. Literally every week I send out several notices to people that we are declining to accept their case for investigation. And like I
cases that you have, the cases that are waiting for you to write, and then there's the cases that you can't take. So there's sort of three different pots of.
And 3 staff turnover this year. So those vacancies hurt our operations and delay justice further.
Thank you for coming in.
Always here to paint a rosy picture for you all.
For a week.
Yeah.
Thanks for your work. Anyway, we appreciate your work and your time, and thanks for making some time to come and see us about it. Thank you.
Thanks for good work.
Yeah. All right, take care.
You too.
Katie, I think you're up next. We're going to move right through this afternoon. Erin has us on a tight schedule. This is S36, an acclimating to Medicaid payment model for residential substance use disorder treatment services. And I will just remind people that this passed out of Human Services on an 11-0 vote. That's how we're starting in on this. Do you have a question before we get
Yeah,
started?
okay, I'm just trying to look. It looks like it's not a strike all that. They just changed or added a new section.
You will need to use Katie McLean, Office of Legislative Counsel. Hello. You will need to look at 2 documents. So first S36 as passed Senate, and then Human Services added some new sections. So I'll take you through the as passed Senate, and then I'll take you through the Human Services section.
Before we get started, I want people to go with the mindset that I'd like to vote today if we can do that. Okay, if people have objections, we can
Well,
wait, but I think we ought to be able to vote today.
But it was only 11, nothing.
It's only 11-0. Jim, do I have to trot out my lecture again?
That's something wrong.
Okay, that's okay, thanks.
So the first 2 sections are nearly identical. One applies to high-intensity residential treatment for substance use disorder and co-occurring mental health disorder. And then the next section, section 2, addresses low-intensity residential treatment. And the language has to do with Medicaid reimbursement. The language says that AHS shall provide coverage for medically necessary, high-intensity, medically monitored residential treatment episodes to Medicaid beneficiaries with substance use disorder and a co-occurring mental health condition when medically necessary, high-intensity, medically monitored residential treatment episodes are prescribed by a healthcare professional employed by a residential treatment program who is practicing within the scope of the professional's license and the residential treatment program is participating in Vermont's Medicaid. So a lot of words. But what we're looking at is that the provider at the residential treatment program who is licensed to provide this type of care is the person who's deciding how long the episode of treatment is. And so that's really what you're seeing in that language. And then in subsection B, coverage provided under this section shall be for the entire length of stay prescribed by that person at the residential treatment program, who shall take into account current best practices for each level of care within the substance use continuum of care. The next section is almost identical. You'll just see that the lead-in language describing the type of facility is a little different. It says for medically necessary, low-intensity, clinically managed residential treatment episodes. So that's the only difference in the two sections is how the service is described. And then we have a report related to the same topic of Medicaid reimbursement for these residential substance use disorder treatment services. This language says that AHS is to conduct a review of the Medicaid payment model for residential substance use disorder treatment services with special consideration given to the actual cost of providing treatment services, commensurate with the length of stay, co-occurring physical and mental health needs, and post-residential treatment services. The results of the review comes to the policy committees on or before December 1st of this year, and the review shall include recommendations and proposed legislation to align the Medicaid payment model with the clinical needs of individuals receiving residential substance use disorder and ensure coordinated transitions between residential substance use disorder and treatment providers offering varying acuities of care. So this is a report to sort of reassess the payment model based on an average of 14-day episodes. You'll see the language at the end of this is sort of focused on the idea of varying levels of acuity and creating a continuum from one level of service and stepping people down to lower services as they progress to that. So that is what that report back is on. And potentially, depending on what is in the report, what the recommendations are, the language that we just went through in sections 1 or 2 might be fine-tuned.
This is kind of the oversight and accountability follow-up on these programs that we're asking for with these reports.
Yes. So now we kind of are making a pivot in sections 4 and 5. These two sections are related to each other. So you may be familiar with the public inebriate language. This is language of somebody is incapacitated and they're approached by a law enforcement officer. They need somewhere safe to be held until they are no longer incapacitated. Where will they be held? Right now, the existing statute authorizes that they could be held in a correctional facility. There is language that has been passed by the General Assembly that has never taken effect that says they cannot be held in a correctional facility. About every 2 years, the General Assembly bumps out that date of when that language takes effect for maybe the past 15 years. So this proposal is to repeal the language that has yet to take effect, which would mean that until the General Assembly takes a different action, individuals who are incapacitated could be held at a correctional facility.
Which is the practice now.
Which is the current practice. So that is what you're seeing in these sections. So now I'm going to switch documents and show you the Human Services document. Okay, so Human Services is adding sections 6 and 7. So with regard to the language we just talked about, the language that has been called the public inebriates language, Human Services is asking for a report to better understand what's being done to expand services in the community instead of having to use a correctional facility as an option. So in subdivision 1, the Departments of Health and Mental Health's existing plan to expand public inebriate services and program shall prioritize Chittenden County.
Why is that?
I'm trying to remember specifically. I think that's where they see the most use and where there are the fewest resources in the community to
Okay, so they have a
Versus-
plan that exists now
Mhm.
to expand, and they're just saying prioritize Chittenden County.
Yes. And then there's a related report that's, or I think it's a presentation and not a report. But by February of next year, the two departments are to jointly provide a presentation to the policy committees describing efforts to expand these services pursuant to subdivision 1. So it's saying, come to the policy committees and tell us what you've been up to. How is this plan working? How are you able to expand these services? Similarly, in subsection B, this is also requiring a presentation, but this one is from DOC to the policy committees, describing efforts to reinstate the practice of connecting individuals receiving these services in a correctional facility with appropriate community-based substance use providers. So what the committee heard is that prior to COVID, there was a more of a connection between when a person came into a correctional facility, they were incapacitated. When they were being discharged, there was some type of handoff. I don't want to call it necessarily warrant handoff, but a connection to substance use services. And since COVID, that hasn't been continued. So this is asking DOC to present how to reinstate that connection. And then Section 7, this is another sort of pivot in topics, but this is the Human Services Board proceedings, and this is another report. The committee has a bill on Human Services Board proceedings in front of it, took quite a bit of testimony, and was poised to start moving the bill out. And then they decided that there was a lot of information they still wanted to know more about before moving the bill. So my understanding is that they are asking for this report and hoping to move that bill next year once they get this information.
Who is the Human Services Board? Do you know who's
The Human Services Board hears appeals from many, but not entirely all of the programs that AHS offers or benefits that AHS offers. So if a person feels that they were eligible for a benefit and they didn't receive it, that is the body that would hear that appeal and make a decision.
they've been placed on the child abuse registry or? Dave, you have anything else to add to that? No. Is that about right? Okay.
Yes.
Okay.
Thank you.
So this is asking for a written report, and it's broken into two parts. So the first part, the report is coming from AHS with consultation from the board, Office of Attorney General, and each of the agency's departments that's hearing, presenting cases or responding to cases before the board, and community partners. And the specific inquiries for that report are asking for a proposal that attorneys representing the agency or departments participate in training that balances the attorney's ethical obligations to zealously represent the attorney's client, meaning the department or agency, with respectful trauma-informed treatment of appellants who are often pro se. Second, an analysis of varying appeals processes specific to the agency and each department with cases before the board, including proposals and any legislative action necessary to improve consistency. Third, a proposal to identify and collect currently unavailable data in a manner that ensures uniform data collection across the agency and departments with cases before the board, including data regarding cases resolved prior to reaching the stage of the hearing officer or the full board involvement. And lastly, any other recommendations required by legislative action. Subsection B, we sort of flip the approach with the board leading the conversation instead of having the AHS being the entity responding to the inquiry. It's the Human Services Board in collaboration with AHS, the departments, Attorney General, community partners, and individuals with lived experience. So in that report, the committee is seeking a proposal to improve understanding of board processes and accessibility to appellants, including the use of media and graphics to explain what the board is and how it operates. A proposal to exchange of periodic feedback as part of a continual quality improvement process between the relevant stakeholders. Page 4, an analysis of how to enable an appellant to present a personal narrative without jeopardizing the appellant's case or disrupting the legal obligations of the board and the attorneys representing the agency or the board. There's a lot of conversation that appellants don't realize the sort of court-like setting of a human services board proceeding. There's a lot of emotions and objections that keep the appellants from being able to sort of tell their story or tell their narrative. So the committee is interested in working into the process a way by which a person could tell their story without, unbeknownst to them, sort of undermining or jeopardizing their case.
And so most of these folks that are there don't have lawyers, so they aren't experienced in
Mhm.
how this would work. And so that's why it sounds like we want to have that kind of training and education or
Mhm.
support for that. Did you have a question?
I do. I'm looking at the two versions. And it's asking for a lot of report backs.
Mhm.
They're funded by just their directives to the state agencies.
Mhm.
I'm looking for the appropriation request. Am I missing something?
You are not missing anything.
Medicaid.
Yeah, but it's reporting back on,
But isn't this piece would not be the part that costs any money, right? I think it's the original bill where there's Medicaid is involved. So there's a potential Medicaid impact. That's why we get it. We get it sometimes. Is that what you're thinking it is?
I am. I'm trying to
Yes.
remember what was in the underlying bill, but the underlying bill looked a lot different.
Because so it's a Medicaid impact when somebody's deciding how long they can stay in one of these treatment facilities. We had a bill like this last week or something that there wasn't actual money, but there was a potential Medicaid impact depending upon what happens.
okay, but does this actually impact the Medicaid or is it just saying,
My understanding from the House was that on the floor, we were asked by AHS to draft an amendment that added the language of medical necessity in sections 1 and 2. And because that language was added, it would be budget neutral. That's what we were told on the House side.
good to know. Now, second.
Oh, Senate side, I'm sorry.
Senate side, right?
Yep.
Secondly, in the Senate passed version, there's a section 6 effective date. Go to the amendment, section 6 got replaced. So is it just assume the default to July? Do we need an effective date or not?
You need this language, and by renumbering the remaining section to be numerically correct. So this line 9,
Line 9 on page 4.
this is telling the House Clerk's office that there's
Section 8 is
Yeah,
effective.
there's another section and it will be renumbered at the end, yeah.
Good. Thank you.
Any other questions, Wayne?
I got a question, but let's back up. It's a word of the language. You might want to finish what you're doing.
I'm pretty much done. There was one more reporting requirement, recommendations to improve data collection analysis. And we're renumbering sections to be numerically correct, and there's a new title after passage.
So on page 2, line 19. A proposal to identify and collect currently unavailable data. It's the word unavailable. If it's non-existent, it would be unavailable. If it's unreported, the word is, to me, may not give good instruction to whoever's going to do the report.
Yeah, I take your point.
Do you anticipate it's data that exists that just hasn't been presented?
I anticipate it's something that could be collected, but isn't currently collected. It's not. For example, one piece of data that the committee was really interested in was knowing how many cases sort of close out before they reach the board.
So unreported might be a better word.
Yeah.
Exists and hasn't been reported.
Potentially.
Not going to do that. You want to do an amendment on this?
No.
Okay. No. Yes, okay.
This may not be something that you would know, but in the budget, there in section B 313, we funded $1 million re-engagement beds, withdrawal management. Are any of those beds, because the language in here talks about the Departments of Health and of Mental Health's existing plan to expand public inebriate services. Is this related at all to that?
I can't answer that question.
Yeah,
That's a-
okay.
Better question for the department or for your
Yeah.
fiscal staff, yeah.
Where you go?
Okay, Jillian, go ahead.
Yeah, you said that amendment said that it can't, medical necessity and therefore it's budget neutral. Is that that's from the Senate side?
But on the Senate side, right before it went to the floor, AHS asked for amendments to section 1 or 2 to add, is it medical
Medical
necessity?
necessity.
Yeah. And so that was added in sections 1 and 2. And the explanation for them asking that was that it would be budget neutral with that language.
Is that line 12 in section
Mm,
1? Page 1?
hold on, I have to
Medical
switch
necessary,
documents.
high intensity, is that universally necessary?
Yeah, 5 and 6 on page 2, in section 2, sorry, and then in section 1, it would be lines 9 and 10 on page 1.
And then it's repeated again.
By coverage for medically necessary, high intensity.
Yeah.
Because it said medically necessary, it came to us.
So the question I have is that, you mentioned the 14-day Medicaid payment
Mhm.
for these kinds of conditions.
Mhm.
My memory serves me that 14 days is not very long and it's not necessarily adequate. Yet there's language in here that seems to say that B says it'll be for the entire length of stay prescribed by a healthcare professional employed by a residential treatment program, which take into account the B section of both.
Mhm.
Two.
So-
How do you, who determines the medically necessary, and how do you do that when you are going to be, I mean, this could take months.
Mhm. So the explanation about the episodes is that they pay for an episode of care. And an episode of care could be 4 days, it could be 24 days, but on average, it's about 14 days, and so it's reimbursed for 14 days. This language has the medical provider, the healthcare professional at the residential treatment program who's working with the patient, making the decision as to how long the episode will be, how long the patient needs that episode. But you can sort of see that like we have this high intensity residential, there's low intensity residential. So the idea that somebody that they might need care for a long time, but maybe not like the highest acuity care for a long time. So an episode would be for treatment at one particular type of service provider, and then the person might step down and have other episodes of care at lower intensity levels.
So if you're averaging that could be like 28 days of medical payment, or it could be more. Is that the budget issue we're talking about?
It's sort of who is making the decision about how long the person needs care is the issue that's being decided. And it's based on medical necessity, not on a standard formula that everybody needs the same amount of days.
Just thinking of medical necessity may be 4 months.
It could be,
Or whatever.
but likely not at all of the same level. It would likely be that the person is stepping down, although, that doesn't mean they couldn't step back up and then be stepped down again.
But did anybody talk about that scenario where it could be a whole lot more time and a whole lot more expensive?
The committees did take a lot of testimony on both in the Senate and House on this. I'm not always in the room when they're taking testimony, so I don't know if the specific question you asked.
If a fiscal note was required, we would have it.
Okay.
Yes.
All right, thank you.
Any other questions for Katie? It was 11-0. Thank you for that reminder. Are we ready to vote on this bill? So Katie, help us out here. Do we vote on the bill as amended by Human Services?
I believe so.
Senate passed version amended by the Senate and further amended by House Human Services.
Yes.
They didn't do a strike off.
I did not do a strike off.
Okay.
I believe they voted once in their committee room.
Again,
It's, whatever the number
We need
is,
to
S
say-
36 as amended by the Senate and further amended by the House Committee on Service.
Madam Chair.
Yes,
Senate healthcare.
I don't think they were, wait,
The Senate is an amendment, right? Wasn't that
Yeah, the Senate had a strike all,
or as passed by the Senate? They
yeah,
did.
as passed.
As passed by the
As
Senate
passed by the
and-
Senate and further amended by the House Committee on Service.
what's your question?
Well, my question is, I understand the implications for Medicaid, but there was no fiscal note attached to this,
That's
right? There's no, so we don't really know what the potential fiscal impact is. So
Not
the
for the
reporter of the bill, which I'm assuming is me.
I think it is.
Yeah.
Despite the fact that
I-
there's public inebriates in there,
Uh-uh.
it's not a big part.
Yeah.
It's not the reason we're doing the bill.
So I'm just wondering,
So I would suggest talking to Noah.
okay, my best friend, all right.
Yeah.
Will do so.
Before you do your report.
Yep, thank you.
I saw where that was going.
Yeah, okay, yeah, no.
All right, so is there a motion to support the bill? Jim? All right. Any further discussion? See, yes,
Didn't we vote on this in the House last week, on their version, the inebriate piece?
There's language moving in two bills on the public inebriate language. My understanding was that miscellaneous judiciary, is that the bill that you looked at last week, that they,
I thought there was something we voted on.
yeah, judiciary's looking at a bill. Right, they are looking at a bill.
I don't know if they've decided to remove it, but the two bills came over from the Senate with identical language.
And I think that bill is still in judiciary, so we haven't seen it.
Or anything about inebriation.
We haven't had it here in this committee. We're on the floor.
I think what I mean, it seemed to me that to me, there's some big questions here about Medicaid. I mean, mental health, substance abuse, these are financial black holes. Which we're
Right.
dealing with.
And if it was significant, we would have had a fiscal note.
We should have had fiscal.
I don't know. I don't think so. I don't think so.
That's
Dave?
my personal.
We won't, people won't know this financial significance till the report comes back. Won't know until next year. What they,
Voting on the reports.
for the reimbursement study. They could have. I would, in my mind, as I thought about the financial aspect, I said, well, we'll know that next year.
We're not voting on what it actually will be. We're hoping, I mean, there's a little bit of,
Doing a study to find out what it would be,
little bit of open
in my mind.
hair here, but yeah. Okay, just want to verify it.
I think we see it.
Okay, we've had a motion. Just to approve this bill out of House Appropriations Committee. All right, if clerk is ready, let us call the roll, please.
Representative Blumenle,
Yes.
Representative Dickinson,
Yes.
Representative Harrison,
Yes.
Representative Konsenska,
Yes.
Representative Roche,
Yes.
Representative Lewicki,
Yes.
Representative Magro,
Yes.
Representative Squirrel, yes, Representative Stevens,
Yes.
Representative Yakavoni,
Yes.
and Representative Shy.
Yes.
11-0.
Look at that.
You predicted.
And I got a text from our committee assistant who said she spoke to Nolan regarding a fiscal note and he spoke to AHS. Because of the language around medical necessity, no fiscal note is needed. To understand that further, we will, Chip will go talk
But it could
to
be next year when you get the report.
Oh, yeah, it's coming.
Yes.
It's coming. You gotta.
And hold.
Yeah.
That's next year. That's why we get reports, so we know what we're talking about.
Oh, we love.
Katie, thank you very much.
Good to see everyone.
Thank you.
Committee, we have one more event for today. It's the reporter of the bill. Department of Health is not here yet. Why don't we take a 5-minute break and go off?